The coronavirus was the third leading cause of death in the United States in 2020, according to the CDC. The death toll since the pandemic began is nearing 552,000. More than 30.4 million cases have been confirmed, and health officials are warning of yet another surge. Still, there is some good news. The U.S. is making major strides in the race to vaccinate. More than half of the nation's seniors are fully vaccinated, and more than 97 million people have received at least one dose. Meg Oliver reports from Newark, New Jersey.
Tonight, the nation bracing for a fourth wave as cases continue to climb. New data from the CDC showing the highest number of cases per capita concentrated in Michigan and the Northeast, including Rhode Island.
I have never been through a year as difficult as this one.
Dr. Megan Ranney treats COVID patients at Rhode Island Hospital.
I'm seeing lots of folks who are around my age coming in with COVID.
Why are we seeing an increase in the younger patients?
They have not been vaccinated yet. And the second is they're now going out and about.
Are states opening too soon?
I wish to God that states would hold on just a little bit longer.
At least 18 states have lifted capacity limits on most or all businesses, and 19 currently have no mask mandate. 2 more, Alabama and Utah, will discontinue theirs in the next 2 weeks. Today, the Biden administration pleading.
We need a simple thing of every governor, mayor, and local leader, simply to maintain or to reinstate mask mandates.
And tonight, Michigan signaling where the nation could be headed. New COVID cases exploding from about 1,100 a day to more than 5,000 a day in just over a month. The largest increase, newborns to 19-year-olds. Today, Pfizer reporting its vaccine is 100% effective at preventing symptomatic cases in children ages 12 and 15. And a sign that vaccines are having an impact. Yale New Haven Health in Connecticut seeing a nearly 70% reduction in patients over the age of 55.
But what's that means is we're seeing a lot more 30 and 40-year-olds coming in.
Patients like 32-year-old Louis Carleglio, who had a harrowing battle with COVID.
I didn't even know I was close to intubation at any point, but apparently I was.
I think the message is nobody is completely safe unless you're vaccinated, and then the ones around you are vaccinated.
Across the country today, FEMA opened up 4 more mass vaccination sites like this one in Newark, New Jersey. Meanwhile, breaking tonight, 15 million doses of the Johnson & Johnson vaccine were reportedly ruined by human error at one of their manufacturing partner plants. All future shipments have been stopped. Lana?
Meg, thank you. For more now, let's go ahead and bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Thank you for being here, and thank you for all that you do. So 1 in 5 adults in the U.S. are now fully vaccinated, but cases are still rising, Dr. Adalja, and fueling concerns of another surge. What's going on here? How many people need to be vaccinated before we really see a trend lines heading in the right direction?
So what's happening now is you're seeing the demographic shift when it comes to infection. You're seeing a lot of cases in younger individuals who are, by definition, ineligible for the vaccine, and you're seeing them be more risk-taking, taking more risk behavior. That's what we've seen before in the summer surges from last year. And that's just really a fact of the matter is that the vaccine just hasn't made it to those groups yet. And we're not going to see declines in cases until younger individuals are eligible to be vaccinated. But what's different about these cases now is that they're sort of decoupled from hospitalizations and deaths, because our high-risk individuals, nursing home residents, community-dwelling high-risk people, they've all been vaccinated more or less. At least one dose or a high proportion of them have been vaccinated. So that's removing that ability of the virus to threaten hospital capacity. So while we're seeing a surge in cases, to me, it's less concerning than prior surges because we've taken the most vulnerable out of the equation through our vaccine. And I think the message here is to get more vaccine into those younger age groups, and then we're going to start to see decreases as we get maybe 50% of that population below 65 vaccinated.
It's interesting, as we have seen more Americans become eligible for the vaccine, it seems like the conversation about side effects has begun percolating again. So if you could remind us, what can people expect as a side effect for the vaccine, and are these side effects normal?
The side effects are normal, and what you usually experience is injection site pain. So where you got the shot, that's going to be sore, usually mildly sore after the first dose. And then you may also have a headache, some fatigue, some muscle aches and pains. Most of that is more pronounced after the second dose, but it's not something that's debilitating. It's something to anticipate. It happened to me after my second dose. I took Tylenol and I still went to work and worked an overnight ICU shift on the day after my vaccine. So it is something that's manageable, but you should expect that. It's nothing to worry about. And I have not seen any very serious side effects that have been life-threatening, at least in my experience. And I haven't seen any safety signals that would put people off of the vaccine. So it's just the normal muscle aches and pains, fever, headache that you might get after a vaccine that you can take Tylenol for. And it's something to anticipate, but not to worry about.
Let's talk variants now. The head of the CDC says that the coronavirus variant first found in the UK now accounts for 26% of the circulating variant in the United States. It's also the predominant strain in at least 5 different regions. Remind us what we know about this particular variant and how we can all stay safe.
So this is the 117 variant, or it's also called the UK variant. And this is one that's been found to be more transmissible and likely a little bit more severe than the original strain of the virus. But the important point to remember about it is that it doesn't transmit magically. It still transmits in the same way. So if you're wearing a mask, if you're washing your hands, if you're avoiding crowded and congregated places, you're going to be able to avoid this variant. The other important thing to remember is that our vaccines are robust against the UK variant. Our vaccines are able to handle it. So the solution to the UK variant spread in the United States is to continue the common sense measures and to accelerate vaccination as fast as possible. And you may even think about prioritizing vaccine to places where this variant is highly prevalent.
Well, more than 12,000 cases of coronavirus variants have been confirmed here in the U.S., and officials say that number could actually be higher. Do you believe that states might be underestimating the threat that they pose, particularly as we see a lot of these mask mandate rollbacks?
Well, definitely when you look at the number of variants that are confirmed, that's just the tip of the iceberg because we don't sequence every case. We don't have a full situational awareness of where these variants are and how prevalent they are. And what I think is important to remember is until we get more of the population vaccinated, it's really important, especially as states are opening up, to continue to encourage people and give guidance to people to wear face coverings when they cannot social distance. Because this is going to be something where if there is a variant present, the variant is going to be much more unforgiving when it comes to lapses in people wearing masks or not social distancing or not washing their hands. So we need to keep those types of recommendations in place as more people get vaccinated because of the variants, because we still have a lot of community spread of this virus.
And one last question for you, Dr. Adalja. The CDC says that coronavirus was the 3rd leading cause of death in 2020, and that those deaths were higher in minority communities. CDC Director Dr. Rochelle Walensky says that this information should serve as a, quote, catalyst. What does this mean? How do you respond when you hear this headline? And what more needs to be done to reach minority communities?
There's a whole lot that needs to be done, and it's this virus really kind of laid bare some of the problems that we have with certain chronic diseases that affect minority populations, such as obesity, diabetes, cardiovascular disease. And I think that this really should be a time to think about how do we make our country more resilient to the next infectious disease emergency or to influenza. And I think that has to do with trying to solve some of these chronic health problems in minority communities, because if we leave this population vulnerable, the next pandemic can come around and cause the same type of problem. I think now is the time that people are really reflecting on how do we do this better the next time? How do we fix these problems? And I think this is one theme that I think should not be ignored.
Dr. Amesh Adalja, thank you.
Thank you.